Hey everyone, this is Dr. Tim here with your daily dose. Today we're going to be discussing ashwagandha and its effects on neurological health. So what is ashwagandha? I know that you guys have probably been seeing it all over the place, so we're going to be making a video about it as well just to inundate you even further. Ashwagandha is actually an evergreen shrub. It's a medicinal herb that's found in regions in Asia and Africa. It's got brain-soothing chemicals that help decrease swelling, lower blood pressure, and reduce stress levels in general. How does it help the nervous system itself? So it actually helps reduce the release of stress hormones, things such as cortisol in your body that usually get released during times of high levels of stress. It's good to have cortisol and stress, but sometimes it gets released on a unregulated basis, which could cause nerves, it could cause depression, it could cause a bunch of other anxiety stimulating type of situations that may not really warrant you to be feeling that way. So what does ashwagandha actually end up doing to those neurotransmitters? So again, it does help reduce cortisol. It helps enhance GABA receptors. GABA, when you have a high level of GABA, it actually ends up making you more chill, more relaxed. So it's helpful whenever you are in times of high levels of anxiety, that it's not needed. Having a little more regulated version of GABA ends up assisting with that. And then also it helps with regulating your serotonin levels. Serotonin is basically the neurotransmitter that helps with keeping you happy, keeping you in a good mood. So if you are feeling depressed, overly anxious, highly stressed, something like this might end up helping out with regulating those types of functions in your brain. Who should be taking ashwagandha extract itself? So things like people that are experiencing symptoms such as stress, anxiety, sleep problems, or depression, it may be a good fit for you. It also, however, it should not be taken with people that have autoimmune or thyroid issues. And folks that are going into surgery should actually be consulting with their surgeon and their healthcare team prior to actually taking it before going into for a procedure, as well as anybody that's pregnant or having any other pre-existing conditions should definitely discuss taking ashwagandha prior to starting it. And just in general, as a mental note, make sure that anytime that you do start a supplement, before you just start taking it, always consult with your trusted healthcare professional, whether it's your physician, your naturopath, your pharmacist, anybody that's on your healthcare team, that you appreciate their insight. They know about all the other supplements, any other medications that you might be taking. It's always, always, always crucial that you end up having that level of support in guiding you and making a good, conscious health decision for including something in your regimen. So is it okay for you to take ashwagandha every day? You should be fine taking it on a daily basis, but no more than 3 months. A lot of the studies that are out there don't really suggest that you should be taking it for more than 3 months. The long-term effects of ashwagandha on chronic intake has not really been studied. So use a little bit of caution, use it for a couple months, see how you're feeling. And then the key thing is trying to address any of the items that might be causing those heightened levels of stress and anxiety in your life too. So always using a Band-Aid like a supplement or a medication is not really the end-all be-all. It's really, really important doing some self-reflection, talking to a professional, getting some sort of help in a support system that will help you kind of adjust, cope, and be able to build more resilience moving forward. It's really, really important. Over consumption of ashwagandha, so if you're taking too much of it, it actually can result in excessive sleepiness, upset stomachs, and other possible medical issues. So again, make sure that you are taking it only at a maximum of about 3 months at a time. How much should you be taking on a daily basis? Well, the recommended amount that healthy adults should be taking is about 300 milligrams twice a day. At this level, it's shown that ashwagandha actually can also assist in cognitive function, including memory improvement, better focus, and increased processing speed. So folks that are having issues such as dementia, forgetfulness, that type of stuff, there has been some effects showing that ashwagandha might be beneficial in helping treat some of those symptoms as well. So what supplements should you not take while you're on this? It may lower your blood pressure, so as a result, it's important that if you're taking specific supplements that might also reduce your blood pressure, that you do not take it at the same time, or again, discuss it with your healthcare professional, see if you should even limit it altogether, and see if there might be a better option for you to be using. Some of these items include andrographis, casein peptides, L-arginine, which is an amino acid, niacin, and stinging nettle. And again, make sure you're always talking with your doctor, your pharmacist, your naturopath, whomever it is that's on your healthcare team, to make sure that they're putting together the best overall regimen for you that gives you the best healthcare outcomes overall. The one ashwagandha brand that we recommend at a nice apothecary is Clear Labs. Ashwagandha extract for neurological health. You can take it for a minimum of 8 weeks, however, no longer than 2 months at a time. And it's nice because you only have to take 1 capsule a day, and that'll help you get that amount that you would need to assist with stress and adrenal support. Step into wellness with a nice apothecary, your comprehensive stop for nutritional excellence. At a nice apothecary, we provide top quality supplements and vitamins to support your health journey. Enjoy a quick prescription filling and doorstep delivery with our convenient services. Discover more about us today and why we're a great fit for your supplementation needs by visiting www.anicrx.com. Thanks so much for joining us today. Hope you have a wonderful rest of your week. Take care. Bye-bye.